Today, we're going to dive into the world of skincare and discuss a new term called hybrid treatments. So we're going to talk about hybridization lasers to achieve superior results. Hi, I'm Dr. Angeline Yong, board-certified dermatologist. Let's talk about how hybrid lasers can enhance your skin. A hybrid laser treatment is, as its name suggests, basically putting together various lasers of different wavelengths and different parameters to selectively treat different aspects of your skin to achieve improvement in various skin quality attributes in the same treatment session. The benefit of a hybrid laser treatment is to try to harness the best of all worlds, basically. So using a range or repertoire of lasers, you are able to selectively deploy specific wavelengths for specific chromophores in the skin. For example, you may want to treat out epidermal and dermal pigmentation at the same time, along with unwanted capillaries, and also want to do collagen remodeling at the same time. So basically, by selecting various lasers that can target these various skin quality attributes and blending them together, you are trying to also reduce the overall treatment time for a patient by basically condensing the number of treatment sessions. So this is not only more effective and efficacious per session, but you are also able, for somebody with a very busy work schedule, to fit in more effective treatments every time they come in for laser treatments. So basically, I think the key thing is a good first consultation. So in the first consultation, your practitioner is able to then delineate what kind of skin quality attributes we're trying to address and what are the various skin concerns. Then they can pick up the right wavelengths or the right lasers to target these various attributes and then try to put them together as a series of lasers on the same day that can be suitable for your skin type. Not every laser can be combined and not everything may be suitable, and in what order can they be deployed. That all depends on the type of concerns that you have, as well as your practitioner's skill set, expertise, and available repertoire of tools. So what you can expect is a detailed consultation on the first sitting and then basically alignment of goals and expectations and a number of treatment sessions. On the day of the treatment session, of course, because if you're doing a hybrid treatment session, there may be a range of lasers that might be deployed, so your practitioner may actually start you off in one room and then move you to another room to actually deploy a second laser. So you might expect a little bit of transition as basically various lasers might be utilized in a hybrid treatment. The skin concerns that can be addressed basically are the same concerns that you would treat with individualized lasers. So a hybrid laser treatment, because you deploy various lasers, can target a range on the same day. You can target pigmentation, unwanted capillaries, skin tone, texture, pores, fine lines, all at the same sitting. Let me give you an example of a hybrid treatment in my practice. I have two laser platforms that are both picosecond technology. So I have an Nd:YAG picosecond platform and an alexandrite picosecond platform, so a range of wavelengths. Now, in a patient typically that comes asking for picosecond laser treatment, I will usually deploy either one or two of them at the same time because, again, they have a range of pigmentation concerns. It can range from epidermal down to dermal pigment, and my patients have dysmetric type 1 to 6, have a range of melanin index on the skin. And hence, different wavelengths are suitable for different people and different types of pigmentation, even in the same patient. Hence, I put two lasers in the same room, and usually I will deploy both at different intensities, as well as utilize them sometimes also for non-ablative fractional remodeling, which picosecond lasers are very effective at doing. The aftercare tips will basically be quite similar to generally laser aftercare tips, and it depends on the main type of hybrid laser you're using. So if you're using maybe just picosecond lasers hybridized, basically it will be the same as a standard picosecond laser. So generally avoiding any harsh topicals on the skin for the first 1 week. Photo protection, avoiding the sun is quite critical for most laser processors, as well as ensuring that you actually put enough moisturizer on your skin so the skin barrier repairs as effectively as possible. If you had a hybrid treatment with an ablative format as well deployed on the same day, then the aftercare tips may also include certain recovery creams that actually soothe the skin better and rebuild the barrier even better. And that can include things such as growth factors, as well as other serums that may help to repair post-ablative laser. So in summary, a hybrid laser treatment basically just means putting together different laser parameters and different laser treatments in order to try to achieve combination results on the same day to save time. Hi, I'm Dr. Angeline Yong, board-certified dermatologist and dermatological surgeon. If you like our content on lasers today, don't forget to like and subscribe to our channel. Thank you.